mynews.studio.
A single shot every 6 months might replace daily HIV pills. What's stopping that from happening right now?
It's July 24th, 2025. We're looking at the World Health Organization's first ever recommendation for a long-acting injectable HIV prevention drug. Why is this such a milestone?
For a long time, HIV prevention has meant taking a pill every single day. That's tough for many, especially in places where healthcare is hard to reach or where there's stigma around HIV. Now, with WHO endorsing lenacapavir, a shot you get just twice a year, things could change. No need to remember a pill each morning. Just 2 injections, 6 months apart.
It sounds straightforward, but how soon could people actually access this shot, especially in countries most affected by HIV?
That's the big question. WHO is working with governments and donors to speed things up. They're putting out new guidelines, helping countries with regulatory steps, and aiming for fast-track approvals. The recent FDA approval is important. It sets an example for others to follow. Plus, they're teaming up with big organizations like the Global Fund to handle purchasing.
So, are there ways for countries to skip some of the red tape, or does everyone have to wait through the same process?
WHO is trying to make it simpler. They're backing rapid HIV testing and looking at community-based delivery. Places like local pharmacies, clinics, even telehealth. Plus, they're working with international regulators to cut down on paperwork. The goal is to get the drug into clinics as quickly as possible.
But what about the cost? Lenacapavir is expensive. How big is that hurdle?
It's a real challenge. At the moment, lenacapavir is much pricier than daily oral PrEP or even the older injectable cabotegravir. Still, there's hope. If demand grows, generic versions might become available at a lower cost. Groups like UNAIDS are pushing Gilead, the manufacturer, to either drop prices or allow generics.
Is there an actual plan to bring the price down, or is it mostly advocacy right now?
There are real strategies. For example, pooled procurement, where big donors buy in bulk, could make it cheaper. Advanced market commitments and tiered pricing are also options. But it all depends on how negotiations go and whether the manufacturer is willing to cooperate.
If the price drops and the regulatory hurdles are cleared, what kind of global impact could this have?
HIV/AIDS is still a major issue, especially in sub-Saharan Africa. A long-acting, discrete injection could mean less stigma, fewer clinic visits, and people sticking to prevention better. That could save millions of lives and help move us closer to ending the epidemic. The shot could reach those who struggle with daily pills, like marginalized groups, or people with limited access to healthcare.
Is this a turning point in HIV prevention, or just another option?
It's both. It's a new tool, but it also signals a shift. Prevention could become easier, more accessible, and better matched to people's real lives.
And if we can solve the price and distribution issues, the results could be pretty clear.
Exactly. The sooner we get this to the people who need it, the bigger the effect.
Today, we covered the WHO's first recommendation of a long-acting injectable for HIV prevention, the possible speed and scale of rollout, and the hurdles around cost and access.
If lenacapavir delivers on its promise, it could mark real progress in the fight against HIV.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.